Bismillahirrahmanirrahim. In the name of Allah, the most merciful, the most kind. Surah Al-Kahf, Ayat 77 says, So they set out until when they came to the people of a town, they asked its people for food, but they refused to offer them hospitality, and they found therein a wall about to collapse. So Al-Khizr restored it. Moses said, If you wished, you could have taken it for a payment. Continued in Ayat 78, Al-Khizr said, This is parting between me and you. I will inform you of the interpretation of that about which you could not have patience. Now we have case studies of stool analysis. The first case study says, a 50-year-old woman presented to her physician with complaints of chronic constipation and abdominal discomfort. The physician suspected a possible functional bowel disorder and ordered a stool sample for analysis. The patient was instructed to collect a sample of her stool in a clean, dry container and bring it to the lab for testing. The laboratory technician received the stool sample and performed various tests to determine the cause of patient's symptoms. The first test performed was a visual examination of the stool for abnormalities, such as the presence of blood or mucus. The stool was also checked for color, consistency, and odor. The technician then performed biochemical examination of the stool sample to look for markers of digestive function, such as pancreatic enzymes and bile acids. The patient was diagnosed with functional constipation, a condition in which bowel movements are infrequent or difficult to pass due to factors such as diet, exercise, and stress. The physician advised the patient to make lifestyle changes such as increase in fiber intake, staying hydrated, engaging in regular physical activity. The patient also received advice on bowel training and relaxation techniques to improve bowel function. A number of prescriptions are also available for such conditions like lubiprostone, amitiza, linaclotide, lenses, and placanetidine, Trulance. Work by drawing water into your intestines and speeding up the bowel movement. Another case study of a 25-year-old man presented to his physician with complaints of abdominal pain, diarrhea, and blood in his stool. The physician suspected a possible infection of inflammatory bowel disease and ordered a stool sample for analysis. A similar procedure of a stool analysis was conducted, and the patient was diagnosed with the presence of Escherichia coli, known as E. coli 057. The patient was diagnosed with E. coli 057 infection and was prescribed antibiotics to clear the infection. Fluoroquinolones, such as ciprofloxacin and levofloxacin, are usually the first-line therapy. Azithromycin is commonly used as treatment for invasive E. coli infection. Rifamycin and rifamycin SV are also closely related antibiotics that are FDA approved to treat traveler's diarrhea caused by non-invasive strains of E. coli. Another case study of a 60-year-old woman presented to her gastroenterologist with complaints of chronic diarrhea, weight loss, and fatigue. The gastroenterologist suspected a possible inflammatory bowel disease, IBD, and ordered a stool sample for analysis. The similar procedure of a stool analysis was conducted, and the results of the stool sample analysis revealed high levels of fecal calprotectin, indicating inflammation in the digestive tract. The patient was diagnosed with ulcerative colitis, a type of IBD that affects the large intestine. The gastroenterologist prescribed a course of anti-inflammatory medications to reduce inflammation in the digestive system, especially the intestine, and alleviate the symptoms. The patient also received dietary advice to improve her nutrition and avoid trigger foods that may aggravate her condition. Antibiotics like metronidazole, ciprofloxacin, sulfasalazine may be used for ulcerative colitis. Antibiotics are usually combined with other medications that control inflammation by suppressing the immune system or by blocking a specific pathway.